Good day everyone. My name is Alparan S. Adog, BSN1 student of Notre Dame of Tacloban College, College of Nursing. So today, we will be demonstrating to you the health assessment and physical examination. Definition: health assessment is the collection of data about an individual's health. Physical examination is a head-to-toe review of each body system that offers objective information about the client and allows the healthcare provider to make clinical judgment. So the purpose of health assessment is to make a clinical judgment or diagnosis about the individual's health state or condition and to obtain baseline data about the client's functional abilities. So the purpose of physical examination is for routine screening to determine the client's eligibility for health insurance, for acquiring a new job, and for client's admission to the hospital. So equipment to be used: BP apparatus, thermometer, watch with the second hand, pen light, tongue depressor, stethoscope, percussion hammer, scaling weight, tape measure for height, and calculator for BMI. So before I start for the procedure, I have here my record book to take down all the assessment na matatapos para hindi makalimutan yung mga assessment na ginawa, which is yung abnormal and normal findings. So first procedure is for the general survey. Identify and explain the procedure to the patient. Rationale to reduce anxiety and promote cooperation. Mama ko po si Alparan, ma'am, ang nurse niyo for today. Ano po ang inyong pangalan, ma'am?
Orpia.
So today po, ma'am, magkakaroon po tayo ng assessment mula sa inyong ulo hanggang sa paa niyo po. Okay lang po sa inyo, ma'am?
Okay.
Next procedure is observe appearance, apparent age compared to stated age, dress, grooming, and hygiene and body build. Rationally observing the general appearance may provide diagnostic to illness. Ma'am, ilang taon na po kayo, ma'am?
60.
Naligo na po ba kayo kanina, ma'am?
Apo.
So, sa nagkita ngayon is okay naman yung katawan, ma'am. Salamat po, ma'am. Next procedure is take body measurements for height, weight, and BMI. First is the rationale to have clients' baseline data. Ma'am, pwede tayo lang po tayo dito, ma'am, para makuha yung measurement ng height niya, ma'am. Diyan. So, ang height niyo po is 58. Dito naman po sa scale, ma'am. Asa. Ay, So, ang timbang niyo po is 88 kg. Upo na po dito. Next naman is i-solve natin ang BMI para malaman yung kung overweight ba kayo or obesity. Plus 2.54 equals 147 divided by 100, 1.47, and then 1.47 times 1.47, 2.16. Ang weight niyo po is 88 divided by 2.16 or 3. So ang BMI niyo po is 29. Next procedure, take the client's vital signs. First is the blood pressure, pulse rate, respiratory rate, temperature, and pain scale. Rationale, Taking the initial vital signs will observe as the baseline data or future comparison. So first is yung temperature. Mga pagkitaas po ng kilig-kilig naman. So ang temperature na po ma'am is 35.2 degrees Celsius, which is normal. Next naman is ang blood pressure. So ang blood pressure na po ma'am is 140/100. Next naman po ma'am is check po natin ang inyong pulse rate in 1 full minute. Next naman is respiratory rate. So, ang pulse rate niyo po ma'am is nasa around 86. Ang respiratory rate naman po is nasa 80. Ma'am, meron po ba kayong nararamdaman sa katawan niyo ma'am?
Wala.
So next procedure is conduct physical examination from head to toe or cephalocaudal using the four skills in assessment, which is the inspection, palpation, percussion, and auscultation. Rationale to assess, determine, and identify abnormal findings in the body system. Next procedure is assessing the skin. First is the inspection for the skin color. Rationale varies light to deep brown and uniform in color. Next is the skin lesions. Rationale freckles, some birthmarks, some fat, and raised mole or nevi moles, and abrasions or other lesions. So, meron pa kayong ma'am, raised moles or nevi. Next is the palpation for the skin moisture. Rationale moisture in skin folds and axillae varies with environmental temperature and activity. Next is the skin turgor. When pinched, skin springs back to previous state. So now let's proceed now to the assessing the nails. First is the inspection for nail texture. Rationale smooth texture. Next is the nail plate inspection for the nail plate shape. Rationale convex curvature, angle between nail and nail bed. Next is inspection for the nail bed color. Rationale highly vascular and pink in light skinned clients, and a dark skinned client may have a brown or black pigmentation. Next is the check for the capillary refill time using palpation. Rationale result should be less than 2 seconds. So, ipipress lang natin ang nail kung magbabalik pa siya into normal color or change pa siya into mag-change pa siya ng color into bluish or pale. So now let's proceed now to the assessing the head. Inspection in palpation for hair, evenness of growth over the scalp. Rationale evenly distributed.
Puto.
Next is the texture and oiliness. Rationale silky and resilient hair. Next is thickness and thinness. Rationale hair should be thick. Next is infection in infestation or lice. Rationale, no infection of infestation should be noted. So now let's proceed now to the assessing the skull and face. Using inspection in palpation, assess the skull for size, shape, symmetry, masses, nodules, and depressions. Rationale, rounded, normocephalic, and symmetric with frontal, parietal, and occipital prominences, smooth contour, and smooth absence of nodules and masses. So first na i-assess natin is yung size. Next is ang shape. Next is ang symmetry. Next is palpate for the masses and nodules. So next procedure is inspect for the symmetry of facial movement. Instruct the patient to raise eyebrows, smile, frown, and puff the cheeks. Rationale, symmetrical facial movement. Ma'am, pwede po bang itaas yung dalawang kilay niyo, ma'am? Pwede po ba kayong mag-smile, ma'am? And that's it for the assessing the skin, nails, skull, head, and face. Thank you and have a good day.